Hello everyone, this is a video about biofilms. Yet another video about biofilms. Seems to be a very popular topic. Always happy to talk about them. Just before jumping into the video, as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone asked a recent question about how to best address vaginal biofilms. So we talk about biofilms in the sinuses and the intestines, possibly biofilms in the blood vessels as well, but maybe not that much, or in the bladder as well, but don't really hear folks talking a whole heck of a lot about biofilm disruption in the vaginal canal. And some folks who have recurring issues with bacterial vaginosis or possibly vaginal candidiasis, maybe other types of vaginal infections. These are sometimes biofilms are really important to go after. I've had quite a few patients to date where they have recurring or chronic issues with vaginal infections. We finally find the right combination of things to work with. Oftentimes, in my experience, one of the most useful things to work with is ozonated oil suppositories. And ozone is just so good at it's great broad spectrum antimicrobial, it's anti-inflammatory, it promotes tissue healing, so it's just kind of everything that we want for in terms of therapeutic outcomes, all sort of in one package. And so say the ozonated oil suppositories are working well, or the boric acid suppositories for bacterial vaginosis are working well, or whatever it happens to be that's working. But then after the treatment stops, then the symptoms start coming back. It's like, well, maybe we didn't treat quite long enough, so we treat again, maybe for a bit longer, stop the protocol, symptoms come back. Now we're suspicious that there's probably biofilms afoot. So in terms of a biofilm disruptor, some of the phase 2 biofilm disruptors that we typically work with, like in my experience, some of the best ones to work with for systemic biofilm disruption include a combination of R plus alpha lipoic acid with bismuth, which, to my understanding, in a compounding pharmacy, they combine those two molecules together to create this dithiol byproduct, which is much greater than the sum total of the two individual parts. So taking an alpha lipoic acid supplement and then a bismuth supplement separately, to my understanding, doesn't work nearly as well as that combined dithiol. And then also a chelating agent like DMSA or DMPS. However, unfortunately, those substances are quite caustic and don't feel very good to administer as a suppository, to my understanding. So my go-to recommendation for my patients is to use EDTA suppositories. EDTA is another chelating agent. It's a phase 2 biofilm disruptor. EDTA is oftentimes one of the main biofilm disruptors we use as a nasal spray for treating sinus biofilms, usually related to mold illness, sometimes other things. And so EDTA tends to be a much more user-friendly experience, shall we say, much less irritating than using other types of phase 2 biofilm disruptors. So that's kind of my go-to. So thank you for the question. EDTA suppositories, that's what I typically use with my patients, but of course, talk to your healthcare provider about what treatment might be most indicated for you. So if anybody has any questions or comments on this topic or anything else, please post in the comment section below, and otherwise I will leave it there for now.